it's a great pleasure to welcome you here to Melbourne today. As Chief Medical Officer for Alcidion, I'm looking forward to getting your views on the most compelling aspects of our technology in clinical practice. As we look at the specific clinical workflow, how can AI help to reduce the administrative burden that clinicians feel in the hospital?
Yeah, I mean the data around the administrative burden for clinicians is quite a challenging read. When you look at the independent academic evidence relating to this, there was a fascinating trial that came out of the States looking at emergency doctors, and they followed them during a shift, and they clicked the mouse 4,000 times per shift. And when you look at the data around the percentage of time spent, clinicians are spending anywhere between 30 to 50% of their time engaging with administrative work relating to the digital systems. So the opportunity here is huge to make a difference. And this has driven a lot of our engagement in South Tees. So using noting as an example. So as a clinician, when I start putting free text information into our noting system, we use natural language processing to codify that and start driving activity automatically. So a really simple example of that is how if I put information into a past medical history part of a form, it will automatically code and capture that information. And it's got lots of benefits. If I'm doing that 10, 20, 30 times a day, that saves me 20, 30 seconds. Multiply that across the shift, across the days, it's just saving. But what it also does is it creates the best possible data platform for our clinical decision support to be working with. So as opposed to it being tucked away in free text, it's now structured in the record. It also supports the coders who are capturing the information and the activity to make sure that the organisation's putting in the right billing and the right claims process to get the remuneration for the work they're doing. So this one tiny intervention benefits me as a clinician, benefits me sort of ghost of Christmas future, and allows me to sort of get the system doing the most amount of clinical decision support. And again, going back to this sort of this co-pilot, this sort of symbiotic relationship. But it also helps the hospital run. It helps it get operational data, claims, billings, activity. So it just a really simple activity intervention can make a huge difference.
I mean, that's great, Paul, but can you talk a little more specifically how AI really works within the Miya Precision platform?
First of all, Miya Precision, Fire-based event platform. So from a technical capability, using Fire as our data standard means that we can orchestrate across a range of different parts of the system. It's been engineered to allow us to bring in information and categorise it within the platform, irrespective of when that takes place. So that can happen in systems external to the trust, and we quite readily look at information such as integrating with ambulance trusts and bringing all of that information into one place. And by having that technical capability and that data standard, what it allows us to do is start thinking about things like predictive analytics. So I talked a lot, and naturally I'm a clinician, I'm going to talk about clinical workflows, but there's also a space for predictive analytics in terms of operational decision making. So how do we help organisations make the best use of resources? How do we understand actually we can see that there's 3 ambulances on their way and we've got X amount of patients sat in an emergency waiting room? How do you make sure that it's the right sort of intervention that's going to make that difference? And the predictive analytics capability combined with the depth of categorised data means that we're able to engage in that type of predictive work. The other thing about it is that not only can we create a suggestion, but we can monitor it and then understand the impact it's making and create this sort of learning cycles. Because if you don't have access to all of the information, you don't integrate it into the system, you might make an intervention, but you don't know. It's sort of anecdote, and how do we drift that managerial operational expertise that exists in care settings and shift them from using anecdote and actually using data? Miya Precision is engineered exactly to achieve that outcome.
So, I mean, Alcidion's Miya Precision can be the orchestration level across all of these disparate sort of technology inputs.
Correct, yeah.
Paul, can you give some specific examples around how compelling Alcidion's technology is for our hospital customers?
It's a really fantastic part of the job to be able to watch the digital health solutions move through that deployment phase into the benefit realisation bit. And one of the things that I particularly enjoyed is the impact that we're having as part of our noting solution. If you look at the academic evidence about noting, it doesn't make great reading, and often it's been associated with deterioration in the amount of time that clinicians spent with the digital system. But actually, as part of our deployment at South Tees, we did time and motion work to follow the clinicians. We've seen a reduction in time of 50% across some of the admin activities as part of the noting deployment. And that's a really significant saving and really talks to the amount of time we've spent thinking about how we shape the solution around the clinicians and that user-centered design piece. We also had independent evaluation of our flow solution as part of a study led by Monash. And that showed a reduction length of time spent in ED, the amount of time that outlying patients that we have, and shortening that length of stay. So again, this is fantastic information to see playing out as part of the benefit that the Alcidion solution is having as it's deployed into different health systems, irrespective of where they are on the globe.
Thinking more around giving some specific examples, can you talk about perhaps how AI within Miya Precision is changing the way clinicians work?
Yeah, absolutely. I mean, we're seeing that as part of the Hampshire emergency deployment. So within the emergency department, in my opinion, have some of the most sophisticated noting capabilities that we really see in the UK. And that pushes out automatic activities based on components of the form. So for instance, a safeguarding referral, which previously used to be a manual process and have a percentage of those that went incomplete, by meaning that technology now detects that referral and automatically puts that in direct contact with the safeguarding team, means we've been able to achieve 100% compliance. And when it's such a critical referral and such a neat example of how we don't rely on people to having to remember it, if it goes into the form and is captured, it's automatically taken away as an activity. And just such a simple thing can make such a difference, A, to the patients who are going to get the best care and the best pathways, but also to the clinicians, meaning they don't have to remember every micro ounce of activity that they've accumulated through a really busy shift.
So Paul, quite specifically, do you see clinical practices transforming alongside emerging technology systems in the next decade?
Oh, this is a fantastic question. So how long have you got? So, I mean, first of all, yes, absolutely. There is an immediate impact that we need to feel now where it supports our clinical workforce immediately. So this is this thing of reducing cognitive burden and trying to improve the experience. So that amount of time that I was discussing that clinicians spent doing administrative tasks, we need to improve that and get that better. But there's also a much more strategic thing that the clinical bodies have to go through, which is trying to understand what's the job we want to be doing? Sort of what does healthcare look like in 10 years' time? And how do we want to have this connection with AI and health technology that makes it easier and better to do our job, increase the amount of time we have to care? That might be care for our patients, but that might also be care for ourselves, or that might also be care for our colleagues, and how we can spend time training and supporting and sort of building that sort of connection across the clinical team. So I think it's a really interesting question and one we don't yet have the answer to. If we start thinking about things like ambient technology and generative AI that sits within the clinical workflow, might mean that I'm de-shackled from the actual physical computer. But then what's the job that I want to be doing? Because we can't purely focus on those productivity changes and getting people to work harder, more intensely across their clinical shift, because that will just not be sustainable. So I think there's a responsibility of the broader health professions to understand what are the jobs we're defining, how do we envisage that to be, and how can we make sure that we're training and developing those roles alongside technology to make it have the greatest impact it could.
So Paul, it was great to chat today. Thank you. It's always so deeply fascinating to get your insights and the insights of our other leaders at Alcidion. A reminder that Alcidion is a publicly trading company on the Australian Stock Exchange under the ticker code ALC. Thanks, Paul.
Thank you.